education here at BCC. Thank you all for joining us here on this beautiful campus here in Northwest Baltimore at Baltimore City Community College, better known in Baltimore as BCC. Today, we know that BCC has been serving as a city-operated mass vaccination site, and we are thankful to be able to provide this life-saving vaccine on such a centrally located campus in a place that we know is well-respected throughout the city of Baltimore. Today is the first day of the Continuity of Government Vaccination Clinic for our city workforce. I'd like to thank Vice President Thomas for allowing us to host this press conference on his campus and give him the opportunity to say a few words. Mr. Vice President.
Thank you, Mr. Mayor. Good afternoon. On behalf of our president, Dr. Deborah McCurdy, I welcome you to the wonderful, amazing Baltimore City Community College. We appreciate you being here today. To our mayor and our health commissioner, we thank you so much for allowing us to be a part of this initiative that is so very important to our community. We truly appreciate the opportunity for BCCC to participate. And we thank you for your leadership and your continued partnership. This is a huge honor for our college to be selected as the mass site for Baltimore City. And we truly appreciate the opportunity to continue to service our residents and our communities. And we're committed to serve as a vital resource for all of our communities. So we are truly honored, and thank you so much for agreeing to continue with our partnership. Thank you.
Thank you, Mr. Vice President. I also know that we have in attendance today Councilwoman Danielle McCray, the health chair of the Baltimore City Council. And just so you all know, following this afternoon's press update, I will be getting my COVID-19 vaccination administered none other than our top doctor, Dr. Jaraza. I invite you to join me in that process as we continue to encourage our residents to make plans to be vaccinated. Before I turn it over to Dr. Jaraza for an overview of where Baltimore stands in the fight against COVID-19, I want to discuss further things. Last week, as I said, the commissioner and I would be reevaluating the data to determine how Baltimore City will move forward. As we have since this pandemic started, we will continue to analyze the data and lean on the expert direction of our healthcare partners. Today, I am announcing the following changes and update to Baltimore's COVID-19 mandates effective next Friday, March 26th. Again, that's next Friday, March the 26th. First, our health indicator assessment period will decrease from every 4 weeks to a reevaluation every 2 weeks. Gatherings will need to comply with any relevant capacity based upon the space in which they are located. Religious facilities will be increased to 50% of maximum occupancy. Retail establishments and malls increased to 50% of maximum occupancy. Indoor recreational establishments, all indoor recreation sites except hookah and cigar lounges will be allowed to operate at 50% capacity. Hookah and cigar lounges are allowed to operate their retail spaces at 50% capacity, but no smoking is allowed on site. Outdoor recreational establishments limited to 50% of maximum capacity. Organized amateur sports allowed with certain guidelines in place. Fitness centers will be increased to 50% maximum capacity or occupancy. Fitness classes are allowed 10-person limit or 25% capacity, whichever is ever greater. And of course, social distancing and masks are required. Casinos increased to 50% of maximum occupancy. Dining areas are allowed to remain open, following the requirements of food service establishments in the city. Libraries will be increased also to 50%. Museums, zoos, aquarium increased to 50%. Food establishment, outdoor dining can resume at 75% capacity. If the space is tented, the tent needs to be open on all sides. I'll say that again. If the space is tented, the tent needs to be open on all sides. Not three, all. Indoor dining can resume at 50% capacity. Bars without food licenses are also allowed to operate 75% outdoors and 50% indoors. All food service establishments must continue to keep a log of contact information for patrons and staff for contract tracing purposes. Personal services increase to 50% of maximum occupancy. Staff must continue to wear face coverings at all times while indoors, and services must be provided on an appointment-only basis, and a log must be kept of customers, staff providing services, and other residents who enter the shop. Theaters and outdoor entertainment venues, live streaming of performances is allowed. Exemption for mask order on performers for live and live stream performances with appropriate mitigation barriers in place. Indoor theaters are limited to the lesser of 50% occupancy or 100 persons. Outdoor entertainment venues are limited to the lesser of 75% occupancy or 250 persons. And again, these mandates will be effective next Friday, March 26th. And now I'd like to turn it over to Dr. DeRaza for an update.
Good afternoon, and thank you, Mayor Scott, for your leadership during this pandemic. I'd also like to thank our partners here at BCCC who have provided this beautiful location for our vaccination pod. I'd like to briefly share the data on key COVID-19 metrics here in the city. As of this morning, we have lost 819 lives to COVID-19. We have had a total of 41,865 cases here in Baltimore City. Our latest 7-day average new case count is 102 cases per day. This is an 11% decrease from where we were 4 weeks ago. Our latest 7-day average positivity is 2.3%, a 2% decrease from where we were 4 weeks ago. Our hospitalization rates have remained steady, with ICU at 85% capacity and our acute care units at 88% capacity. Fatalities due to COVID-19 are now averaging 1 death per day, a 59% decrease from 4 weeks ago. As of this morning, the Baltimore City Health Department and our healthcare partners have reached several important milestones in our vaccination efforts. Over 100,000 Baltimore City residents have now received at least 1 dose of COVID-19 vaccine, covering 17.2% of the city's population. 1/3 of Baltimore's older adult population, age 60 and up, have also received at least 1 dose of vaccine. Over 55,000 city residents have also received their 2nd dose and are fully vaccinated. In the coming days, we will be updating our vaccine dashboard to provide specific breakdowns for single dose versus 1st and 2nd dose vaccination. This will allow us to chart our progress as the Johnson & Johnson vaccine becomes more widely available here in the city. All of this information can be found on our public dashboards at coronavirus.baltimorecity.gov. Review of case data indicates that our metrics have dropped dramatically since the peak of holiday surge during the winter. We're also starting to see increased numbers of residents obtain their vaccination. As Mayor Scott said, at this time, he is loosening restrictions to 50% capacity for most businesses, up from 25% capacity effective March 26. We're also going to begin reviewing the data to evaluate reopening or restrictions at more frequent time intervals. This will allow us to rapidly adjust as needed based on the data. We know that vaccinations are a critical tool in eliminating transmission of this disease. Increasing vaccination rates are crucial in allowing us to begin safely reopening more widely. In the meantime, we need residents to continue to do their part as we look to safely reopen businesses. Wear your mask, practice social distancing, wash your hands, and get your vaccine when you're eligible to do so. As a reminder, testing for COVID-19 remains a vital component of the overall pandemic response, and I strongly encourage residents to get tested if they're either experiencing symptoms suggestive of COVID or if they've been in close contact with someone experiencing symptoms of COVID. Our mobile testing clinic schedules posted weekly on our social media accounts and our website, coronavirus.baltimorecity.gov/testing. Additionally, please remember to pick up your phone when MD COVID calls, as our contact tracing programs also remain vital. As always, please continue to wash your hands, wear your mask, and reduce your contact with others to slow the spread of disease. After the conclusion of this press conference, we will host our first Continuity of Government clinic at Baltimore City Community College, where Mayor Scott will be receiving the Johnson & Johnson vaccine. This one-shot vaccination will play a key role in our efforts to move forward as a city, as it only requires one dose. There's no follow-up or second dose, and it can be stored at room temperature. We remain grateful to Baltimore City Community College for hosting our vaccination clinics over the past few weeks and for assisting the city in vaccinating thousands of first responders, healthcare workers, older adults, and now city employees. As vaccine supply increases, we urge residents to take the vaccine that is available to them. All of the vaccines have been proven to be safe and effective at reducing severe illness, reducing hospitalizations, and reducing deaths as a result of COVID-19. With 3 viable, safe vaccines available, and with more vaccines on the way, we're encouraged by the demand for vaccines and continue to work daily to bring vaccination to city residents as quickly and as equitably as possible. Thank you.
Thank you, Dr. Terraza. I will continue to caution Baltimoreans that this pandemic is still serious. Far too many people, one a day, are still dying from this pandemic here in our city. We know that today is St. Patrick's Day. Do not act a fool today, because you might kill somebody. Understand how serious this is. When you look at our data again and again, you continue to hear me say this. We have our older citizens are dying from this vaccine, but it's the younger ones, my generation in particular, who are contracting it at the highest rates. Be responsible so that your parents, your grandparents, your older aunts and uncles can be here to celebrate you as you mature in your life. Make sure that you're protecting yourself and them and everyone in the community. That's how we're going to beat this. But also, for everyone who's scared about the vaccine, get the vaccine. I'm getting it today for all to see so that everyone can see how it is to be responsible and care about something and others outside of yourself. I'm eager to see more of our residents in Baltimore get vaccinated as the supply allows, and we know that that is coming. We have to be ready for that. All of us have to get vaccinated as quickly as possible. We still have work to do to make sure that the vaccine is accessible to our communities hardest hit by COVID, and you have our commitment that we will continue to do that each and every day. But now, before I take questions, I'm going to get the vaccine. Thank you. You want to wait until we figure it out, or you want me to go? You want to tell somebody something? There we go. I follow the doctor's orders, Keith.
All right, sir. So I'm going to have you take a seat.
I'm right here.
It's up to you.
It's a wonderful thing to get the shot by the head doctor in town. Right. I don't know about his, there's another agency here. You're right about that.
Yes, sir. Mayor Scott is getting the Johnson & Johnson vaccine. That's the one dose, right? That's it. One and done. One and done.
Thank you for hosting us.
Oh, no problem. Thanks for being here. We appreciate it. Yes. We're trying to put the community back in Baltimore City Community College.
Any questions at all?
Man, I've done my research.
You've done your research, but you want to make sure that you recognize that some side effects of the vaccine versus
Have you guys been vaccinated?
No, I think we're actually both
got
gonna
the data.
Get it today.
Muscle aches and joint pain, all of those things are controlled and rest. Try to get some rest. That may be hard for you. But
say that louder for the people over there.
let's try. So here is your vaccination card. In case the vaccine is in, having a lot from it. We'll say that it's
No, man.
Do you have a preference for arm? I think they told me right arm, but I was directed something.
Right arm. That's what they said. All right. Wow.
That makes it a little harder, but I was told they had directed. Oh, no, Mr.
Called the uproar.
Oh, yeah.
It won't be the last time.
Look at that gun.
Watch yourself now, Mike. Watch yourself. I'm gonna be sitting in the chair all day.
That's 15 minutes. 15 minutes after. You gotta sit for 15
Forgot about
minutes.
that part. That's
That's
the
the
hard
hardest
part.
part. That is the hardest part.
You can't let them get sick.
You gotta sit still first.
Keep on.
Now, are you present? Are you here?
They hear you. They get sick.
You're good. You're in front.
Somebody back there still in needles? I hope that's not you, Mr. Administrator.
On three.
She said on three.
All right. I knew that. They can't.
I'm ready. You ready?
On three.
It's happening, y'all.
You good? You guys got the shot?
I got one. That's all. There it is.
Yay! Don't pass out.
Did it hurt, Mr. Mayor? No, sir. Painless.
Look, you don't want the Band-Aid? You gotta get the Band-Aid.
Spider-Man Band-Aid?
It's a proof that you had it.
There we go. You need help, guys?
All right, sir. So 15 minutes from 3:59. Okay. So 3:14. It's live for you, Mr. Mayor. Can you talk?
I will in a second. I'm trying to. There we go. All right. Nope, it's not. Can y'all hear me?
Yeah.
Bueller? Emily, first? We'll take some questions now while I... Emily's right there.
Recently, the governor adjusted restrictions, but you kept the current COVID restrictions in place. What made you change your mind now, look at it, and reevaluate it?
Well, Emily, nothing changed for us. Like I said last week, we had a 4-week... Oh, I'm sorry. Can, Mr. Administrator, can you turn the volume knob up on there? Oh, never mind. Mike's coming. Sorry, Emily.
Go for it, Mr. Mayor.
Sorry about that, Emily. For us, there was no change. The governor's order, as he stated and as we stated, had no impact on what we were doing. We had a 4-week period, and we said we were going to monitor the data through that 4-week period. We did that. talked with the health commissioner and decided to move in the direction that we're doing based off that data and information. No other reason. Mr. Daniels?
Mr. Mayor, you kind of touched on it. How effective do you think your COVID-19 restrictions have been, considering people, before you softened the restrictions, were crossing the county lines? Do you think your counterparts are being reckless with their decision, opening fully?
Their decisions are their decisions. My responsibility are to the citizens of Baltimore. And Keith, what I would further say is that, again, throughout this pandemic, we have had the lowest positivity rate when we've had the difference in restrictions. So we know that it's working. And as I said, not to you, but someone else from your fine station before, we also have to understand, and people need to hear this, so I'm going to keep saying it. When people get sick across this region and state, they end up in our hospitals, meaning that they are putting our residents who work in those hospitals at risk to COVID. We have to have considerations beyond ourselves. And we know that the work that we've done has had an impact, and we now, all of us, can see the end of COVID. But we have to stay the course, not be reckless, but also make sure that people are getting vaccinated. Trey?
Thank you.
Two things. Do you have a response to the president of the Maryland Restaurant Association saying that he's looking at possible legal options, talking about how you're handling the COVID response and lifting restrictions?
So I never talk about legal items that aren't legal items. And when we do, we've been through that before. They have the ability to do whatever he thinks is best for his members. But we will continue to do what's in the best interest of residents of Baltimore. And we know that we had a previous issue in the court system. And we'll just fight for what we know is right and saving lives over everything else.
And you also mentioned how the patients come to the Baltimore hospitals. Would it be easier if surrounding counties kind of followed suit, or could it sound as though what they're doing obviously differs from what you're doing? Would it be easier for county executives to kind of take heed to what you're doing?
I can't speak for them, and I can only speak for the reality that I live in. I don't live in a world where we can talk about possibilities that aren't there. I know the world that we live in today, and that's the world that people get sick and they come to Johns Hopkins, they come to Mercy, they come to University of Maryland Medical System. And I can't speak for my county executive friends who also have done a great job in fighting in lieu of some of the larger state restrictions that we've all thought should happen in the past. But I can only speak for my actions, and my actions are to make sure that Baltimoreans are safe.
Mayor Scott, first of all, how you feeling? You just got the shot.
I'm feeling great. I'm feeling 100%. I actually feel like I can go run or lift some weights right now.
There you go. Nice. There's been some resilience from some people because they want to get certain shots over other shots. I know you kind of discussed whatever shot you can get it in your arm. Can you talk about the importance of that for people?
Yeah, thank you for that, Eddie. Listen, it doesn't matter which shot you can get it. If they offer you Pfizer, get the Pfizer shot. If you get Johnson & Johnson, get that one. If you get Moderna, get that one. The important thing is that you get vaccinated so that we can protect ourselves from this deadly disease. We've lost over 800 people in the city to COVID-19. And what I just did will help save people's lives. So you doing that. That's how we're going to get back to the things that we all want to do. Everybody in Baltimore wants to be eating crabs on the deck with their family this summer. If you want to do that, then make sure that you get the vaccine whenever you can. All of us want to be, come next fall and winter, cheering on the Ravens as they send Tom Brady home and make sure that we win the Super Bowl. If you want to do that, get the vaccine. We know that this works. It's been proven. It's safe. We have seen that tried across the country. We have to get vaccinated. It's important that everyone that's eligible do the right thing, not just for yourself, but for everyone around you and everything that you love. Thank you.
Hello, Mayor.
Hello, ma'am.
Well, it's good to see you in person.
Nice to see you, too.
I have a question. When you were talking about the reopenings and the capacity, forgive me, I was admiring your fro and taking pictures, and I missed some things. Did you say when the Department of Social Services will be open and Social Security? Because I have people that I'm helping trying to get those services, and for months we've been trying to do it online, and it has just not been going well. and they need these services?
Yeah, so that is not a decision for me to make. One would be Social Security would be that's a federal decision, and the Social Service is a state one. But what we will do is make sure that someone from my staff gets your information, and we will take that information back to our partners at that level to talk about how they're going to be doing reopening. As I know, the city administrator and the health commissioner are working to how city government is going to be reopening as we go through more vaccination.
Thank you. They'll be glad to hear that.
Yes, ma'am. Thank you.
Love the pro.
Thank you.
Mr.
Keith?
Mayor, since you still have to chill there for a minute, may I ask this question? Your State of the City is coming up tomorrow, and your 100 days in office fast approaching. So a lot of times,
I was away.
yes. So a lot of people, a lot of observers mark those 100 days with asking you about the policies and so forth that you promised, and otherwise during your campaign. One of which is in your campaign, you promised to reduce homicides under 300 in your first year. Do you think you'll reach that goal? And if so, how?
I think, Keith, thank you for the question. We're going to push every day to reach that goal. We do know that homicides are down in the city. I'm still not satisfied. I'm never going to be satisfied. It doesn't matter if we get it down to 1 a year. I'm not going to be satisfied. And I say this a lot, but for me, these aren't just one-time media stories. These are people. Everybody that lives in Baltimore that has grown up here in the city, we're impacted by this in a different way. When the news story is over, we still have to deal with that trauma, whether it's a friend, a parent, an uncle, a cousin. What we're going to do is what you've consistently heard me say before. We have our police department refocus on the most folks, the most who continue to commit violence in the city, attacking and making sure that they are deeply focused and intentionally focused on those individuals. We also, as you know, announced on Monday how we're now doing something that has never been done in the city before. Never. Building a comprehensive approach that Director Jackson is going to lead through the Mayor's Office of Neighborhood Safety and Engagement that will involve the most important part of that, something that has never been done. My entire life, I've attended community meetings, hearings at City Hall, seen things happen where the citizens have asked to directly be asked on how they can be involved. But it's also about our approach to dealing with the flow of illegal guns in the city, which we announced last week, 2 weeks ago as well. Noting that, Keith, and I want you to make sure you put this in your story, that 63% of the guns that BPD recovered on the streets of Baltimore last year came from other states. We're going to hold those people accountable, just like we're holding the people that are accountable that are pulling the trigger.
Brief follow-up. You mentioned that you were not satisfied and so forth. What are you doing with that dissatisfaction, Mr. Mayor?
Every day, the dissatisfaction is about pushing our agencies, BPD and otherwise, to be better. It's about challenging them to create creative ways to deal with the issues that we have. It's about figuring out how we can better support them and our communities in their work. Thank you. Last question, Emily?
Mayor, I just wanted to ask, you've been eligible to get the vaccine for a little while now. Why today? Why now?
Well, again, I think, Emily, you and I had a discussion about this at the beginning. I didn't feel right. I wouldn't have felt right when we had it at such a low amount of vaccine coming into the city that I was going to be taking it away from one of our older adults or someone that had pre-existing conditions. But now that we're at a point where we're seeing the amount of vaccine increase, we know now that we have a functioning president and President Biden, we know that in the near future we're going to see many more vaccines. We wanted me to get this today as a part of this continuity of government to show our workers that it's safe, but also to use me as an example for, again, my generation, who are the people that are contracting the virus more than anyone else, and showing them that just because we're young and healthy, we need to step up and do the responsible thing and get the shot so that we can protect our elderly folks and older folks around us. Thank you, everybody.